Well, when we talk about in-network providers, whether it be a hospital, whether it be a doctor, or whether it be a pharmacy, when the insurance company is picking for a consumer, a patient, who these best people are, there's no reason for the doctor to do a great job. I mean, in some ways, I mean, I'm not saying, I'm not personalizing that doctors, specifically do a bad job, but if they had to compete for each patient on a patient-to-patient level instead of an insurance network, they would have to do a much better job at a better price, correct?
Yeah, they would. And I think generally speaking, most physicians they're going to treat every patient the same. But when you start taking physicians out of that private practice model, you regulate to the point where they can't have ownership in hospitals. They don't know what things cost for most things. Now, if you think about the surgery center setting, that's different. But most of the time, yeah, you're right. They don't have to compete on price.
Well, I also think that they're not able to discern with their time as to which patient needs more service or more time. And we've kind of accepted the fact that, that they're not going to listen to what I have to say, or I can't give them the information or the tools that they need to have a good outcome. And I'll just throw an example out that I had today. I had a lady who's been working on her glucose and her lipid panels, and her doctor is in a network where they hardly have any time to communicate with one another, and it's unfortunate because she's an educated woman. She can understand the tools that if someone gives her that, if I make these choices over this amount of time, my outcome is going to be different. And we in the insurance model, in the model where people only have 10, 15 minutes if they're lucky, and maybe just a few questions that they can ask their doctor, those outcomes are not going to be really good unless you have somebody that says, I'm going to own ownership with my disease and I'm going to take control of it. But unfortunately, I feel like we've taken that off the table for our doctors and healthcare professionals because of the restriction of time with these regulatory agencies and also with insurance.
Yeah, that's interesting you bring that up. It's 100% true. And I actually call that hamster wheel medicine. And
Yeah.
it's not meant to be derogatory to primary care physicians or nurse practitioners. But I had that same experience actually at a different healthcare system here in Indianapolis 5 years ago. And that's when I started to learn about, direct primary care. And sure enough, I have a direct primary care physician now. And I used to say it costs about as much to fill up your tank of gas, but now now that's a half tank of gas.
Right. Yeah, for sure.
I remember this specific example in this doctor's appointment. It had been 6 minutes, and I'm a young person. I didn't have these complex issues, but I have questions for my doctor. It's all about the relationship, and it's really important to me. And then, he was walking out the door and I was still asking him questions, and I'm not exaggerating. And one of the questions I asked him, I'm like, hey, you should shut the door, man. This is private information. So, you just see that kind of hamster wheel mentality, and you've got doctors seeing, way too many patients. So it does hurt patient care, and I'm sure it hurts satisfaction for physicians.
Yeah, I was just going to say that, AJ, is that doctor didn't like walking out the door in that kind of situation. He wanted to do a better job, he or she, but his hands are tied. I mean, because of the insurance situation and how they're reimbursed.
Well, I even want to comment on the fact that I feel like we have too many in clinics and these big organizations, too many people with business backgrounds telling doctors how to practice medicine. And it's an art form. You have to listen and create a communication and a relationship, because that relationship really matters as to how you're able to deliver care to that particular patient. And we are taking that out and away from them because we are saying, okay, well, we're going to, put this dollar as a bottom line. And I'm pretty sure that most physicians would agree with us, and medical providers would agree that, the bottom line is they went into medicine to help people and to take care of people, not give that MBA a big bonus at the end of the year.
Yeah, it's spot on. And sometimes, I'm that MBA that,
Right.
wow, people are, mad at me. They're not mad at me though, because I'm not that guy.
Right.
And one thing, I'm especially sensitive to this because my wife is a physician. She's a pediatric resident, way smarter than me, I might add. And she lets me know of that, when we're talking about different things related to medicine. That's not my job. And I will never tell physicians what to do or how to practice medicine. I'm here to try to break down doors and make them wide open so that they can practice medicine like they want to and like they used to,
Right.
4 decades ago.
Yeah, and it really wasn't that long ago. I mean, Jan, I've been in healthcare now about 30 years probably. And, 30 years ago, AJ, which doesn't seem that long ago to me, it was different. I mean, physicians controlled healthcare as well as they should. They're the most educated people in the industry. They should control healthcare.
Yeah, and I don't like to give these major huge systems any credit, but Mayo Clinic, for instance, at least their board of directors has 85% physician representation. That's how it should be.
Yeah, that's good to know. I didn't realize that.